A very warm welcome, Ms. Kausar Kidwai. There is one program in which you were eradicating anemia.
It was really very heart-wrenching to see that more than 50% of people, every alternate person is anemic today. Haryana had slightly higher numbers.
I was relating it to the work that NIIT Foundation has been doing. So for last 21 years, we have been in the space of education and skilling. It is really important to generate awareness first.
It's awareness again, and I will go back to what you said. Awareness drives change, and awareness should drive into action, and that action should sustain, and that's how we are able to kind of influence people. सितारों से जहाँ आगे और भी हैं, अभी इश्क के इम्तिहान और भी हैं, तू शाही है परवाज़ है काम तेरा, तेरे आगे आसमां और भी हैं.
A very warm welcome, Ms. Kausar Kidwai. A welcome to NIIT Foundation's podcast series, Building a Better Tomorrow. NIIT Foundation has been doing these podcasts where we've been bringing in diverse experts from spaces in healthcare, education, CSR, and diverse sectors to really understand that how all of us are all working in our spaces but towards common objectives in the social sector. So today I would like to invite you, Ms. Kausar, to kindly introduce yourself and tell us a little bit about your journey.
Thank you very much, Charu, and I'm really honored to be a part of this platform. I think what connects us is intent.
Yes.
And when we talk of intent, I think the only lines that come to my mind are सितारों से जहाँ आगे और भी हैं, अभी इश्क के इम्तिहान और भी हैं, तू शाही है परवाज़ है काम तेरा, तेरे आगे आसमां और भी हैं. I guess these lines have kept me so focused that if whatever you are doing, you have to really aim like the falcon and keep your focus and vision very high. And that's what defines me as a professional. I think in all these many years that I have been building myself as a professional, I have focused on evolving, I have focused on contributing, I have focused on saving lives. And that's what brings me here today. I'm really grateful to NIIT Foundation. I'm also grateful to all the organizations that I have been a part of, because they are the ones who've made me. Thank you.
That's wonderful, Ms. Kausar. So I was reading about some of the very popular programs that you have done. In fact, there is one program in which you were eradicating anemia. And it was the program where how you have really worked at the grassroots levels to identify the audience and then work with them. It was I was wondering if you can really detail us and let us know how you have been going about doing that and what were some of the successful milestones there.
Sure. Charu, in my current role as the head of CSR at Medanta, I think I have learned so much from our CMD, Dr. Naresh Trehan, and the kind of vision he has largely in impacting lives. And Mr. Pankaj Sani, who's our group CEO, more towards how preventive healthcare should be driven. A large part of our mandate comes from these two visionaries. So, taking forward, the question that you asked under how Anemia Mukt Bharat campaign, took birth. This was something that was steered together by the leadership. And given the incidence of anemia pan-India and in Haryana, it was really very heart-wrenching to see that more than 50% of people, every alternate person is anemic today. Haryana had slightly higher numbers. And when we were focusing on the more nuanced, incidences on whether it's only girls or it's also boys, we actually decided to just roll out the program to understand where exactly the problem lies. So it was not only girls, who were grappling with the disease, but there were more than 35% boys also who were anemic. So we then decided to understand what were the needs of this particular cohort, because this is largely adolescent children who fall into the trap of this. So we designed a study, we kind of understood what were the needs. We never, I never believed that one size fits all kind of a theory. And I was then able to conceptualize this program, which has reached more than 50 plus institutions. A cohort of nearly 7,000 has already been touched, where we are carrying forward the message under the clinical guidance of our doctors, who are always there to fall back on. So we conduct, one of the biggest lacunas that I observed was digital screening. There are multiple instances where we probably may think that, oh, it's just an anemia screening, it's a prick and you probably will know what your HB levels are. But no, that's not the case for majority of the population in the country. So simple digital screening test can mean the first in the life of an individual like our cohort. And that's where we started. So we embedded digital screening in institutions, schools, colleges, and we very closely worked with the Department of Health, who have been supporting with distribution of IFA tablets. And in close conjunction, we also conduct repeat testing. So over 6 months to 12 months is what is our repeat testing. I mean, that's how we coordinate that. Today, if we do a test, then we follow up with children. We then kind of do a repeat test constantly under the guidance of our doctors, and also that they should be consuming the tablets. So the schools and educational institutions have also come forward and they have supported the narrative, educated parents. So I think it's more of a multi-pronged strategy, multiple cohorts who have come and supported us in this initiative, and we've been able to drive this message forward. While I still consider that this is a first step and we have a very long way to go, but I am really happy that we have at least taken that first step as Medanta Foundation.
That is really wonderful to understand that the agenda that you have picked up. I think this is really glaring in our eyes, and you rightly said. I was relating it to the work that NIIT Foundation has been doing. So for last 21 years, we have been in the space of education and skilling. And we've realized that through our various projects, when we are going into the community and we are going into institutions to really educate the youth and to prepare them for future workforce, one thing that is something common, and I was saying, is that it is really important to generate awareness first, that why this thing is, because when we take programs, then we feel that they are very powerful, but the audience for whom we are taking the programs, unless until they don't feel the need for it and they are not aware of what transformation it is going to bring about, the programs don't meet their desired outcomes. So it's interesting to understand that when we are educating them, so we finish our training programs and our objective is that they get into livelihood, then our objective is that they should stay course. So giving them a job is easier, but keeping them on track is not very easy. So similarly, when you were talking, I was reflecting that diagnosis is easier, but when you go to the next step of when you're treating them or helping them to navigate this journey and towards a healthy living, what are some of the challenges that you face? It will be interesting to learn.
So yes, I think if I have been able to come that far today, it's more because of my connect with the ground. And none of the policies should be drafted just by sitting in your offices. So when I was out on the ground, when we work as a team, when we are out on the ground, it's important that we also take their perspective as to what resonates with them, what doesn't resonate with them. And I'll substantiate this with an example. The taste of an IFA tablet is a little bitter, and they don't want to have this tablet. So immediately what and this is not hearsay. I mean, immediately what they would do is probably have it with a cup of tea or a cup of coffee, so that the taste would change. And that was something that was completely not advisable,
Yes.
because the absorption of iron does not happen if you have had coffee or tea within 2 hours of consuming an IFA tablet. So what was, and this guidance came from our doctors, that the only thing you can, the best thing you can do is just have it with a glass of Nibu Pani, lime water.
Yeah.
So it'll help you,
Yeah.
it'll help with iron absorption, and it'll also
Yeah.
help with kind of changing the aftertaste. So things like these, small instances, whether it's consumption of IFA, or even talking in terms of cervical cancer and the programs that I have done in the past with regard to this. How do you talk to women in terms of what it is like? So these simple words like, there is some infection, it just needs some bit of sikai is what we usually, was the term that came to us again from the community, is something that we deep dive and take it forward. And that is what has helped us work towards more adoption. It resonates more with all cohorts, and the answers lie in the community. So you have to deep dive and check for these answers from the community, which helps them into changing their behavior, and that's what BCC, Behavior Communication Change, is all about.
Yes, I think that's quite insightful. And when you said that you have to create policies at the ground level and what resonates with the audience, I think that is really the truth, because even we realize that when we create learning solutions, we are also working, with the community to understand what are their learning habits, what will keep them engaged, what will keep them motivated. So the content, everything is designed in a manner so that the appetite is built, so that they can really absorb it very meaningfully and they can enjoy it. So I also was reading that you have done a lot of work when it comes to preventive healthcare. And that prevention, I think, is better than cure. We all have been saying that.
Right.
So it will be great to hear about some of the other preventive healthcare initiatives that you have, participated in, and how, those really helped in translating to some meaningful outcomes.
Right. Yes, prevention absolutely is much better than cure, as they say.
Yeah.
But it takes a lot of courage. And it's awareness again, and I will go back to what you said. Awareness drives change. And awareness should drive into action, and that action should sustain, and that's how we are able to kind of influence people. So some of the campaigns that have been really very close to my heart is the cervical cancer screening and treatment program that I did as a part of my previous organization, which was Clinton Health Access Initiative. Under the current organization's umbrella, it's a massive awareness campaign on self-breast examination, which again is basically for women to evaluate themselves and to be able to diagnose early.
Right.
Under both these campaigns, the most common underlying factor again is and was fear. People are not very comfortable when we talk about disease, and here we were talking about cancer.
Right.
So my only message at that given point, and even today, is that and this comes from again one of my interactions with a doctor. He's a very senior radiologist at AIMS, and he said, Kausar, tell me one thing. I mean, the day somebody has diabetes or hypertension, does that person think about rolling it back? Or no, we accept it, and the only thing we do is we manage it better. I understand the word cancer it hits you very hard, but it is like any other non-communicable disease. It needs to be picked up early, and it needs to be managed well. If you're managing the disease well, then you will be able to add more quality years to your life. And that, Charu, just resonated with me so much that it completely transformed the way I was looking at this campaign. And this campaign was started in Madhya Pradesh, the cervical cancer screening campaign. We also introduced new technologies for treatment, which actually reduced the cost of treatment significantly from nearly 750 rupees to literally 25 paise per person. Additionally, while we were screening at primary healthcare level, treatment was being offered at secondary healthcare level. So it was bridging the gap between supply and demand, and also focusing on how the women would come forward and adopt this. So a lot of massive awareness campaigns were run on this, whether it was the field level workers, the frontline workers, as we say. So we actually screened them first, and they became our brand champions. So the ASHA workers, the Anganwadi workers were the ones who were screened first, and they became our brand champions, and they drove the message of screening in the community. And it led to the screening of probably India's largest initiative, where 2.5 lakh women were screened under this campaign.
Wonderful.
And of the ones identified positive, 63% also received treatment. So it was not just screening and not providing treatment for the pre-cancer that they were identified with, but I'm really happy, and it really infuses me with a lot of enthusiasm that these women got another opportunity to life. And similarly with this campaign that we are currently kind of rolling out under Medanta Foundation, which is called Aao Dekho Seekho. It is again a preventive healthcare initiative where we are driving the message of self-breast examination, and the unique feature here is simulators. So a lot of times people will talk about a lump in the breast or possibly some kind of symptoms, but we don't know what these symptoms look like. So these pure silicone breast models, which have actually become an added attraction, we take them in sessions, and people are so inquisitive, and they come forward and they touch and feel and see. So it's the whole idea of touching and feeling and seeing for themselves that they will then be able to relate. And so yes, we are getting a lot of people who are signing up, coming forward, learning. And in one of our recent and the most recent initiatives, we've signed up with Government of Assam in taking this program to 5 districts and reaching up to more than 2.5 lakh households. So yes, preventive healthcare does have very, very significant space in our lives today, given we are losing we are practically losing every other woman identified with breast cancer, and a life lost is not worth the effort.
Right, I think that is really a great initiative, and that is the requirement of the day, how to make people aware so that early detection can happen, or prevent. It is like prevention. So I was thinking that it is often said that for education you need a healthy mind and body, and it is so beautiful that to have the healthy mind and body you have to resort to education. So these both are actually supportive roles for each other, health and education. And while you were talking of experiences in the health sector, I was relating to it in the education sector. And I feel that to amplify some of the programs that the health sector is taking up, there can be organizations like us, because we are doing mass awareness programs when it comes to when it comes to awareness in digital literacy, financial literacy, cyber awareness, now with AI coming and storming the workplaces. So we are doing a lot of awareness around that, and safe search. We have also been doing a lot of work inside communities where we do a need analysis and understand, and there are many places where the requirement for health programs is there. They are not aware of the government policies, they are not aware of the government schemes, and we have been building a lot of content around that and trying to go to the deep interiors to make people aware. So what do you think can be a very beautiful model where people like you who are doing deep work and people like us who can help you amplify this deep work, can come together and really meet the common objective that life, saving that life, or creating a healthy life, a futuristic outlook
Yeah.
towards life. So what do you think are your views on that?
So you've really hit the nail on the head. We really need institutions like NIIT Foundation to come forward, and education and healthcare are. I always will call them conjoined twins.
Right.
Given I'm in this domain,
Yeah.
they're inseparable. And unless and until you take these initiatives together, I think it'll be very important for us to sit down and curate which target cohorts we would like to address, what are the initiatives that we need to drive in the community, and as a very significant step forward in the work that we are doing, technology plays a very important role.
Yes.
I can just go back to just about 15 days when one of our AI-enabled X-rays picked up a 12-year-old girl with tuberculosis.
Okay.
And she was having persistent cough for the last 7-8 months, but she was not picked up. But that one visit, and an AI-enabled X-ray, it was out in the open. Similarly, with the way NIIT Foundation is going village to village and taking forward the cause and the learning objective ahead, I think learning and lives, they have to go hand in hand.
Yes.
We can definitely look at avenues, campaigns, cohorts, and work together at the intersection of healthcare, technology, and learning.
Yes.
And drive this mission forward, because I totally believe that unless and until you make people aware.
We have digital buses which are going into remote interiors, and we are really penetrating into the remotest places so that we can take education to the doorstep. And I think the way you all are working, your objective is to take the privileges to the remotest area where people are most unaware, and to create that awareness. How do you think that we can, co-create something? If we have to design a program which can be done jointly, what would it look like?
So I've been lucky to see one of your buses, and if I were to share my first thoughts as I was walking into the bus, was I'd never imagined that a bus that we use in the community for screening patients could be transformed into a learning space also. So by virtue of just saying this, I think the answer is out there and staring at us in the open, that yes, there is a possibility that we can definitely build on something together, because I believe NIIT is not actually just literating, providing literacy. It's basically about educating people, and there is a very big difference between literacy and education. And education and healthcare go hand in hand.
Yes.
So when I think about a bus which has BP screening, anemia screening happening, OPD consultations happening, X-ray screening, breast cancer screening happening, the same bus is kind of being used to impart education to people. I think closest to their homes, this is going to be a journey with a cause.
Yeah, I think that sounds like a very beautiful program, and the strengths of training, creating awareness and educating, and the strengths of really diagnosing and giving the treatments, I think when these can get combined, we can really help to amplify the impact of a joint program. It would be also interesting to understand that when we work in education, like NIIT Foundation tries its best to make efforts that we get aligned to some of the government vision and policies, because a lot of work in the background has already been done by government when it comes to identifying the needs, the aspirational districts in terms of various thematic areas, and we realized that it is important that while we find pockets where the need is, but it's important to align to the government vision because they've already identified those areas which are really needy. And I'm, I was reflecting that for you also, how does this policy and government framework play an important role?
Um, Something which is very critical to this discussion, policy, how does that work? I always feel that it's important to go hand in hand with what the government priorities are. The only way to impact community at scale, and I'm a firm believer of this, is through the public sector.
Yes.
We are all working in our zones and spaces, but I think it's collaboration that is going to help, tying up with the government, which is going to help. The government sees a lot of value in the kind of work we all are doing in our spaces, but I think it's more of cohesiveness that is required, and policy always helps and supports. I will definitely again help you, with another example. Our TB-free initiative is in line with the National Tuberculosis Elimination Program. Our oncology screening mandate is in alignment with what Government of India is mandating for.
Okay.
One of my initiatives, in the previous years, I think 4 or 5 years back, this was the COVID-19 pandemic, and the government was talking about COVID-19 vaccination. It was the same time, we were talking about HPV vaccination. But given that the government priorities were different, it was not aligned well in the policy, we could not get that kind of traction. And we had to kind of just phase away the overall strategy and the advocacy that we have put together to be able to increase the uptake. So now I think it's a very good time, because you might have just heard that the government has approved the cervical cancer vaccination program. States are going ahead and vaccinating their girls.
Yes.
It's very important that these girls get vaccinated. 9 to 14-year girls get vaccinated, and again, it's prevention, and our girls need it. So coming back to policy and coming back to what the government intent is, we should constantly, given that we are out in the field, we should constantly we should be supporting the government with what is the requirement on the ground, what kind of policy tweaks are required, what works, what does not work, and these stories need to be told, and they need to be told loud and clear. And driving campaigns in line with the government's mandate and policy always helps to impact people at scale.
No, I think that's absolutely true. And when you were talking, I quickly recalled that we have an agreement with NIIT Aayog, and when we work with NIIT Aayog, we are going into the aspirational districts, and we are going with their agendas. Now, what is happening is that government as an enabler really helps you to penetrate, because like you were saying that if the government was not aligned, that attention, you did not get that attention in certain places. But we've experienced that when we have the overall framework, then the whole attention to the cause is created by the government framework. And then when you're working in the local blocks and districts, then you really get attention to what you want to do. And when all the stakeholders come together, the impact of the program really goes up. So I think you're right that it really helps if you're aligned well with the government.
No, and it's actually directly proportionate to the outcomes that you're expecting in any project. We are currently working on how we can provide treatment to thalassaemic children. Now this is again another program that we have recently started, and it completely aligns with the government's mandate, number one. Number two, the government has taken ownership of the entire program. And with these kind of strategic partnerships, they have a line listing, they mobilize patients, we bring in the diagnostic expertise that we have on the ground. And Dr. Trehan always believes that, giving anybody a chance to life is probably the best way of giving back to the society. And in line with his thought process and vision, this program was developed. And given you just spoke of how the government's ownership transforms.
Yeah.
I have recently witnessed this because, private sector arranging for camps, the turnout would be fairly very low. But with the government arranging for these camps and government taking ownership and we patching in what we, bring to the table in terms of clinical expertise, I think it goes a long way,
Yes.
These kind of partnerships really save lives.
Yes. So I'm really wanting to ask you an interesting question. What are your views on organ donation? Because this is something which is the biggest cause that every human being can create in her or his life. And while the heart is there, but what is holding back individuals when it comes to organ donation?
Something which immediately comes to my mind with this is that this is one loss which gives a life. So one person is losing the life, but the other person is gaining. So a loss which is giving life to another individual. The situation in India is such that if you look at, what is the India probably records the lowest organ donation rates globally. It is less than 1 per million, and in India alone, in the last 5 years, we've lost more than 2,800 people only waiting for an organ. We have a line list of more than 80,000 patients in India currently, and if I were to just simply say that one person who's coming forward and donating can save up to 8 lives. So in this initiative that aligns with Medanta Foundation very, very closely, the numbers are very small right now, but I am very hopeful that this is going to go onwards and upwards from here. We've touched nearly, close to 1,000 people. We've got 4 people who've registered as organ donors, which equates to 32 lives. But what I felt across in this journey was that these are religious beliefs that are holding people back. It's the fear of, what happens after I die. It's that fear which kind of holds you back. I've had children walk up to me. I mean, we run this campaign in colleges. Students have come forth and said that if the day we go back and talk to our parents, they will just ask us to not discuss this any further, and they will just brush it under the carpet. So you need to have a session for my parents. And I hear that child very, very closely. And so what we are trying to do is first break all the myths around it, identify what are the challenges, also rope in religious institutions from all communities who can come forward and talk about it. And the day they take ownership, I'm sure a lot of people will come forward, because there is no service to humanity as great as organ donation. We've had so many instances of, a child, whether the child was 8 years of age or 20, 25, 40 years, brain dead individuals whose families have had the courage to come forward and donate. And the only thing I can see is, seeing your child still live long after they are gone. It's that kind of happiness that organ donation brings to you. Yes. And every smile takes a courage.
Yes.
And I think this is the courage that we are looking for.
You're absolutely right. NIIT Foundation is in the mission of educating young minds and really helping them to transform lives, to lead a very healthy and happy life. Now, and what the work Medanta Foundation and you all are doing is to really bring the health into that life, to prolong that healthy, happy life. So I feel that the missions are so aligned, and I'm sure that universe will bring forward an opportunity where we can align our missions and really bring the communities forward to help us meet our objectives. Thank you so much, Kausar. I think it was a really enlightening discussion and a very heartwarming discussion with you. Thank you so much.
Thank you very much, Charu, for the kind words and for giving this opportunity to bring forth the work that Medanta Foundation has done, to bring forth the work that I have done in the community. I think what connects us are two L's, learning and living. And that's what NIIT Foundation and Medanta Foundation stand by. I am really looking and hoping that we should be able to curate something together to be able to impact the many lives that look forward to institutions like us to be able to bring that change.
Thank you so much, everyone, for tuning in. We look forward to seeing you in our next episode of Building a Better Tomorrow, an NIIT Foundation podcast.